Dealing with excessive sweat and help for aging hands, the top cosmetic fixes for everyday issues.
Serving all of San Diego, this is your Fox 5 News.
Right now we are showing you some of the latest cosmetic fixes for all of your biggest beauty problems, and here to talk about it with us this morning is board-certified plastic surgeon Dr. Vincent Marin, and he's going to show us how we can do this without going under the knife, and that's the key here, right?
Absolutely.
All right, let's start with one of the first problems, which is facial asymmetry.
Yep.
Okay, so what do we have going on here?
So a lot of things people will come at us, and if you look at this picture here, everyone has some degree of facial asymmetry, and a lot of what happens in beautiful faces is balance. And if you look at this girl, her upper lip is much smaller than her lower lip. And so what we're trying to do in simple changes, and you can see in the after, is try to get more balance where it takes something that's out of balance and draws attention to something that looks full and beautiful. And so part of it is just taking a simple thing such as Juvederm or a filler like Restylane, and those are things that we can easily do in the office. It takes about 20 minutes. Someone come in and there's only topical anesthetic. We'll put that in. It'll last for about 6 months, and it'll help balance things out. And lips are just one example of where we can use that.
Very good. Okay, so let's talk about help for aging hands. If you have hands that are looking older than you do, what do you need to do about that?
So one of the things that really gives away a woman's age is their hands.
Sure.
Women know that to take care of their face, they know to take care of their chest, but the hands is something that's ignored. And if you look here, when you're young and healthy, your hand kind of looks like that plum, but as you age, you lose volume, there's sun damage, and you end up more like this prune. And so what we're trying to do is restore this prune and get that volume back, and it's something simple, again, we do in the office. You can look at this image here. You can see some of the tendons in the back of the hands. A lot of women will complain of visible veins. We do a little simple filler that gets in there right underneath the skin, almost no anesthetic whatsoever. It's very well tolerated, and it just makes that hand look much younger. We can sometimes add that in with a little laser if there's a brown spot, and that can make your hands look 20, 30 years younger.
And how many sessions do you need to go to get this kind of result over
One
there?
time.
One time. And how much are you looking at paying for
We're
that?
looking at probably somewhere around $700, $800.
Okay.
And it'll be both hands. It's one syringe, and it can last up to about a year.
Okay,
Yeah.
cool. All right, let's talk about those fine lines and brown spots and blood vessels that a lot of us deal with.
So that's one thing I just touched on, that kind of light laser that we're doing, something that we can get in there, and you can see some examples here of women. A lot of times the first thing they'll see is some of these fine lines and wrinkles beneath the eye out in that crow's foot region, and you can have a patient that will come in. This is sometimes 2 or 3 sessions, but we'll go through, we'll kind of do a light laser in the office, and you can see some of the changes that you can go through and actually have a quick, easy change. Downtime is maybe a long weekend.
And how long are your results going to last?
You'll probably last about a year to 2 with this.
Okay.
One of the issues is what got you there in the first place. It's usually sun exposure, that type of stuff. It doesn't stop your skin from aging, but it turns the clock back.
Very good. Let's talk about sweat this morning. Sweaty underarms and the brow sweat that'll mess up your whole hairstyle.
Yeah, it's the interesting thing. The same chemical that causes you to sweat is the chemical that causes your muscles to contract. So what we've realized is that Botox is a great chemical inhibitor of sweating. And so what happens is, you can see in this example here in patients' underarms, and this is for excessive sweating, not necessarily normal perspiration, but what we can do is find the areas, usually in the hair-bearing region of the underarm or in the scalp. We mark this area, you treat it with Botox, and you can eliminate sweat in that area for about 7 to 8 months.
That's huge.
It's a great procedure, tiny little needle. It takes about 10 minutes.
And you're looking at like the 50 shots, right, in some cases.
You're looking at, in essence, it's a whole vial of this Botox. Normally we use about half when we treat someone's face. When you do the armpits, we're looking at a whole vial. You'll treat both sides. I guess they have, maybe there's an animation of some of this stuff, but it's, as we go through, it's a great treatment and lasts for a long time, and will solve the problems. I guess they have this goes through, we can get to it as it gets to a sweat gland, but part of the skin's whole purpose is a protection. So that's kind of, we want to make sure that that sweat is not overly treated and diminished.
Very good. Some insurance carriers will pay for it if you...
It depends on if you have good coverage.
But some of them will cover it for you, just FYI. Okay, let's talk about evening out your brows.
Brow asymmetry, a big thing that people have. We're talking about with the lips. We're now looking at the brows. This woman just has a hyperactive, stronger muscle on the right side. You can see when she raises her brow. Not only does it create the lines that most women don't like, but there's an elevation higher on that side. If you just treat that with Botox and we're a little little bit more aggressive on one side. You can lower that, even it out. It looks much less odd. It's a much more attractive result just to make that go away. And there's nothing wrong with that other than her muscles just work asymmetrically. And that's something we're just trying to easily improve. Again, Botox, 5 minutes and it's fixed.
Lastly, let's talk about annoying peach fuzz on your face.
It's something we've been doing for a while. It's called dermaplaning, and it's actually, you take a little knife, and I've got a little, since peaches are out of season, we've got a little kiwi, but you can see you kind of take that knife and you can remove some of that peach fuzz, but at the same time you're taking away some of that extra dead skin that's on there. You can see what we'll do is the kind of phenomenon you'll get on the procedure, but what it does is it takes away that excess skin. It allows for increased blood flow. It helps that all the products that you have sitting on your bathroom cabinet to penetrate more deeply. So it's a great thing to rejuvenate your skin. You can see kind of in this illustration, there's the skin that's being, excuse me, the dead skin that's being elevated with that. And what it does is it really helps rejuvenate the skin. You don't have to do it more than maybe once, twice a year, and it will eliminate the peach fuzz. Some people that actually have a problem with that. But it's great to help stimulate vascular inflow, that new blood flow to that area, and rejuvenate your skin and brighten it as well.
You don't have a problem with the peach fuzz lately, do you?
No, I've stopped my dermaplaning. Is what's happened. So you can see the problem.
He says this is his winter look. He's got his winter look going on. I kind of like it too. Hey, listen, to get in touch with Dr. Vince Marin, you can do that at Marin Aesthetics in Del Mar. We posted a link on our website, fox5sandiego.com. You can go there and click on the Scene On tab. By the way, the phone number, well, it was just on your screen. Hopefully you wrote really, really fast. Raul, back over to you.